Does routine testing make a difference? My answer to that is a resounding yes. Routine testing for HIV is something that we've taken way too long to get to. Unfortunately, from the beginning of the HIV epidemic, we have always behaved as though we have a limited amount of testing, apparatus, and that we can only test some people, so we should pick and choose. And when we do that, we miss people, right? We miss people who look like they don't need it. Right? They've come into our care. We know that it's very possible that they can come and see us and actually either not be comfortable to tell us the reasons that they're at risk for HIV, or maybe they, honest to God, don't know, right? So they are telling us what they believe to be true about their lives, right? That they are low risk, right? And so we know that it's possible that they could think they're safe, but they're not. We know that. But we still set up a situation where they have to identify themselves as being high risk, therefore needing an HIV test. And it's so wrong. It's okay for lay people to maybe not get the nuance of this, but we know better. We know so much about this disease. We know so much about how it's transmitted, and we know that people could actually not know that they're at risk. And if we know all of that, then it's wrong. It's absolutely wrong, unethical, borderline malpractice to not offer HIV testing. And particularly if we're taking care of people who are living in poverty and living in zip codes that are heavily impacted by HIV, it is wrong for us to see them understand this and then set up this dynamic where they have to identify themselves. And that is something that I'm very, very proud of at this hospital, that they have undertaken this mission to be sure that everyone who comes into our doors is offered an HIV test, and that we don't continue to miss opportunities to diagnose people and to get them into care.